All right. Hello, hello. Welcome, everybody, to our first lip thread seminar. Very excited to be here with Dr. Nicole Bell. Welcome, Dr. Bell.
Thank you for having me today.
We are here in New York, actually in Brooklyn to be specific.
Downtown Brooklyn.
Yes, yes, yes. And Dr. Bell is a very famous, as many of you know, injector out there. She is the proud owner of multiple medical practices here in the New York area. And more recently, her aesthetic practice has really taken off, and it has caught our attention with all the amazing work that she's been doing. So again, thank you for joining me. My name is Stacy Reynolds. I am the founder and CEO and very active business person within the organization, and I am thrilled to be here. Again, welcome.
Thank you, Stacy.
Thank you.
It's a pleasure being here. Welcome to New York.
Thank you.
I am born and bred in New York, and what I'd like to share with you all today is that you're in for a special treat. Placing threads is very popular here. If you haven't heard a lot about the technique and the procedures, you will tonight. And hopefully you will also be encouraged to try the techniques yourself and introduce them in your practices. And so I invite you all to just continue to follow us and to learn, because I'm really here to spread that message. It is a fun technique. It will take your practice to the next level. And it is a game changer. And what I love about threads most, is it okay if I share this?
Oh, please.
Is that it is probably the only procedure that I do in my office that is foolproof. Everything else tends to fade over time very quickly and diminishes, as you all know, the timeline for most fillers and Botox. But threads gives you that longevity. So if your patient pool has a particular or a particular person has a procedure that they love and they really enjoy getting that area enhanced, but they get so disappointed when the product is absorbed, then you have something else, a special procedure that you get to introduce, and they will love you for life.
Oh my gosh, that sounds awfully enticing. Dr. Bell, can you tell us how long you've been doing threads and really what kind of turned you on to the threading procedure itself?
So I like to share a little bit about my story so you understand kind of like the evolution of threads. I would say that we're probably in this country introduced them a little later than other countries. So originally in Israel was one of the first places where I had the opportunity to observe the technique. And I remember that particular trip was back in 2015. Before then, of course, I went there on a mission. I heard so much buzz about the procedures, and my patients were asking me, but they weren't FDA approved at that time. So it was just really important to me to seek out, new advanced techniques, and that's how I even got into aesthetics, and to learn the purpose behind the procedure and what the results look like. So I had an opportunity to observe some cases, which was a lot of fun. And I must say, like, even the Europeans are ahead of us. So it's popular everywhere. And even though it seems to feel like we're a little late sometimes in this country, I must say that what I do appreciate most is that we have very safe measures for our methods to apply the procedure, and a lot of safety goes into place. So the way that the cannulas are designed here and the thread itself are very different. And so me having that tactile ability to use them, place them, see them, and direct them, I've noticed all of the nuances and the changes. And the best part is the ease. So it is kind of foolproof. Like I said, you place it and you're done. And it's not very time consuming. There are some times when you may want to add a little anesthetic to the procedure, but it is a very simple placement.
Excellent. So you've been using threads for quite a while.
Yes.
And we know that you have a very large following on social media. If you haven't started following her yet, check her out. It's at the, with 2 E's, Lip Doctor.
Yes.
And I bring that up because as the lip doctor, you are the woman to be showing us threads. So when did you make that transition from just traditional facial threads to specifically lip threads as well?
That's a great question. Believe it or not, I think that in terms of facial enhancements, lips have always been very popular.
Mm-hmm.
People tend to like to start with some basic, like Botox, some less intimidating areas. And I think it's for several reasons. Sometimes they just want to become comfortable with the provider. And then other times they want to make sure that that procedure doesn't change their face very much. Mm-hmm. So they're testing out products and they tend to take baby steps. Threads, although more advanced, give you a more natural look. Mm-hmm. So the opposite happens in my office. So patients come in and they say, I want the procedure that is going to look the most natural on me. And so those are the patients that I present the threads to. And they're not always prepared, unless they followed me, to have a procedure like that done. But if they are a candidate, they usually get very excited. And they're excited about knowing that I can place them and you can't detect them like fillers.
I love it. Well, and you bring me to a really important question that I think everybody's asking, which is not when the demo starts. That's going to be in a moment. But the other burning question for us, particularly in the industry, is when do you make that differential between filler versus threads or versus a combination therapy treatment?
So it depends on the patient selection. And that's honestly what it comes down to. You have different age groups that come in, and some are looking for trends. Some are looking to reverse the aging process. And you really have to gain an understanding of their expectations. Are they realistic? And, if they want multiple syringes and your concern is injuring the tissue, then that's when you can alternate and add the different procedures and balance it in order to get the best result. And there are other times when you have a patient that's aged quite a bit due to whatever circumstances and may need a stronger treatment and have expectations for a stronger result. I have a lot of patients that say, I will never consider plastic surgery or a facelift. However, they're all for lifting thread.
Sure.
And it surprises me because they're wide awake. Mm-hmm. You're scared of general anesthesia. Well, you'll sit in my office and let me place 10 threads. And they're like, absolutely. Mm-hmm. But it's that confidence that they gain in watching you, knowing your experience and your background. If you have the ability to build a case base, once they see those cases, they understand that you have experience in doing this and they really appreciate it. And they're impressed that you can do this and procedure and under a local anesthetic.
Sure. Wonderful. Well, I think everybody's waiting for the big moment. Let's dive in and discuss the ideal thread candidate and really how you go about doing a consultation for that. And then we'll dive into the procedure itself.
Sounds good.
All right.
We're ready. Okay, and we're going to move in this direction. So I'm just going to place gloves on and we're ready to get started. This is my lovely patient. Of course, I've worked on her before and I know her, so we're very comfortable with one another. Now, this procedure you can do either sitting or standing. And excuse me for just a moment because I am going to just move out of the frame a little bit and grab some gauze. And we will begin the entire consultation process just so you get a gist of how to address your patient. And I do have to grab a minute.
While we're waiting for this intermission, we have placed a limbing cream on our lovely model here, and that's been on for approximately 30 minutes or so?
About.
Okay, so she's good to go and ready to get started.
I am back, and we're ready to start. Okay, so now that I have everything that I need, we're ready to look at our candidate. So I know that she presented and she expressed to me that she would like for her upper lip to be raised just a little bit. Mm-hmm. And she already had a filler placed. And she had multiple fillers. She loves the fact that her upper lip, which once was flat, is no longer flat. And now she would like to gain more of a flip. So that popular technique called the lip flip, we're going to kind of bring that to life. So this threads makes your practice so much more fun. I get asked probably in the neighborhood of 8 to 10 times a day to do lips and to do specifically a lip flip on their lips. So it helps when you have an understanding of what the public likes, what the trends are, and that you follow them and you try to achieve them also. And it does build popularity in your practice. I don't necessarily just follow the trends, but I'm a listener. You want to help the patient. And if someone does have a severe flat lip, sometimes it's not the most flattering thing in the world. It's their body, it's not yours, it's not your choice. You're not altering yours. You're altering your own, theirs. You're not touching your own. You can, so you have to, just make sure that you're a good listener during the process. Do not over exaggerate any procedures by any means. So if they're asking for a specific number of threads, I would tend to then specify how many are safe to place in their particular case, and just help to educate your patient. I think that all of those factors are very important. Now, when I look at her lip in particular, I noticed that the lip, actually her vermilion border is well defined at the top and on the edges. So as she slopes on the right and left side, if I can add more width to the sides, so you're gonna look straight forward. If I can add more lift here on the sides of her vermilion border and add more width, that will give her a much more voluminous profile. And that's really important. That's what people want to see. And this is considered advanced. So, bear with me. This is not a Botox lip flip. This is not a filler lip flip. They look very different. So I'm trying to cue you in on specific things that I look for to identify what makes this a lip flip. So I can show my patient. First of all, I take a picture before I even started. So that was the very first thing that we did. And then I show them thereafter. And when you show them that variance, boy, you blow them away. They're really excited about their results. They tell everyone, and you get the entire family and all their friends. And that's kind of what happens. It's like a trickling effect. So what I would express to her is that her oral commissure really slopes. The vertical of it slopes deeply. So she loses the corners, right? And when you lose those corners, it just kind of flattens your lip and it looks awkward. And that's how filler tends to dissolve. People lose their corners very quickly. So that's something that I look for. And when I place the threads, when I use a brand that I love and they have great lengths for lips, you can really address all of that well. So I know in my mind that although she may even want some volume in here in the future, but she placed some denser fillers, I would opt to just treat her vermilion border initially. So I'm going to be very detailed about this because I want to help you to develop your language so that when you're presenting your cases, the patients are impressed and they really get excited about what you're going to do. Because if you do it like the 15-minute Botox, I don't like that concept. Nothing should be 15 minutes. Then they don't feel like you're customizing it to their needs. And it's really important that people feel that. So once again, we're going to address this border, but guess what? Not only are we going to address the border, but we're going to give her a little lift in here. And that Cupid's bow, I designed it, so that's with filler. I'm going to make it look even more enhanced, more like that McDonald arch. Not quite as exaggerated, so I don't want you, but just to give you a perception, since we're not zooming in on her, that's the look that I'm going for. Let's see what else I noticed and what else. I'll give you some other options that you could consider, but we're going to do something fairly simple because although threads in particular are advanced, we're going to stick with like a beginner thread procedure. Once again, stay focused at the camera. And so we're going to place the threads. We're going to begin right in the corners, and I'm going to follow the vermilion border. I know that she wants a lip flip. So I'm probably going to take it a 0.5 millimeter behind that pigmented area. So that's really, really key and important because sometimes you don't want to do that. And, in particular, if you have a very new candidate, someone who says they want to go home, I hear this all the time, and they don't want their husband to know. Do not ever place it beyond that vermilion border. Keep it in that pigmented tissue zone area completely. So that's really important. So I'm going to, like I said, place it a little bit behind the border, and I'm going to draw it out for you. You get to see. And you know what? If I use this, you'll have a better image. So this is basically where I'm going to, this is my initial point on each side, tilt, my initial point on each side. I also like to measure my threads. And by measuring, I don't mean like I pull out a Bowley gauge or anything in particular, nothing special. It's too time consuming and it becomes a little inaccurate. So you just use it as a gauge. So I'm gonna show you my little quick technique that I do, and I just like to see the complete length of it and how far it's gonna go. So it's gonna, if I place it here, but I wanna land in the Cupid's bow, I can either place the multiple threads, that's one option, or I can just make sure my entry point is close to the little marker there. So it sort of depends on what's more important to the patient. For all intents and purposes, I know I'm going to see her again. So I'm not going to place a large amount because she recently had a filler placed. I'm going to do it in stages. I will also suggest that when you place threads, you're very honest with your patients. Although we know that they have a longer lifespan, but before they are completely dissolved or begin to lose the effect of them. We know that people are not symmetrical, right? One lip is never exactly the same on one side as it is on the other. So what I'm going to always encourage you to explain to your patient is that, listen, Mr. So-and-so, you're definitely a candidate for these threads. I'm going to place an equal amount per side, although you're not perfectly even, but I'm going to require you to come in for a second visit. And in the second visit, you can alter it and add it. But initially, you should always start with an even amount and a very even placement, even if their lip is not even or the symmetry of the face isn't even. So in this case, we're looking at the border. I wanted you to get an image of how much of a lift we want to achieve. So I'm going to place a marker so you can just get a quick little visual of where I'm actually placing it. And see, she has a rolled border. So I'm going to place it right Well, exactly what I said, a 1/2 millimeter behind that rolled border. So if I have her tilt, that's where the placement is. Come in a little closer so you can see it. Very good. There we go. Looks like a mustache today. We're not making mustaches. Okay, so hopefully that helped a little bit. Were you happy with my assessment? Would you like a lift in your on the vermilion border? You're aware of what that is because we had a discussion, but would you like to raise your overall lip border? And are you comfortable with it being a similar width to the lower lip?
Yeah.
Okay, so with that being said, again, remove these little marks so she doesn't have the appearance of a mustache on the video. Very good. And as long as they're happy and accepting, we can move forward. We've already taken a medical history. You don't have to be as concerned with any, side effects other than bruising, which is expected with all of the aesthetic procedures. But typically, patients next will ask, what type of anesthetic are you using? And some of the concerns are, what is the pain level like? Because fillers tend to be a little intimidating. So you can only imagine what cannulas, what their thoughts are about the cannula being placed in the lip. And oftentimes they'll even ask me like, well, what is a thread exactly? So then I begin to address those issues. So as I approach them, they don't pull back. And I want to give her some comfort. I know that you already have a lot of faith in me, but we're still going to review that a little bit. And I know you guys want to see this procedure, so I'm going to lift her up a little bit. And we're ready to start. We're good? Okay, so I'll let you take that. Okay, so I'm going to continue with, don't worry, we're getting there. We're ready, almost ready for the placement. But this is very important stuff, and I want you to have the same level of comfort when you address your patient. And this is the fun part. This makes you the cool doctor, and you should be. You should be relatable. You should be fun. People should enjoy you in the room. But getting to the important part, the placement. So I place topical. I've already done it. Don't worry. You don't have to sit here any longer. I have actually given her several layers. So find a topical that you're comfortable with, just a local, whatever I use usually has about 4% Lido in it. If they're very weary and you're familiar with them and they're super sensitive, you can find a 1% Lido and just, place it in a little 1 ml syringe and go ahead and go around the border a little bit lightly. You don't have to give them a lot. I would say about maybe a little less than an ml on the entire, if you were treating the entire lip. And that's fine. And your patient will greatly appreciate it because they won't feel anything. Do not use an excessive amount because the fluid distorts the lip shape, and then trying to decipher your borders and your boundaries becomes very challenging, and you may not land evenly. So I try to stray away from it when I'm working on lips. That was a question that came up, and we're going to give you opportunity. So I do want to make sure that you understand that you're free to send questions. That's why I paused a few times. Feel free to continue to send them our way. I will answer questions once we complete the procedure. I just want to make sure that I'm being very thorough, and I hope that you're enjoying this portion because I know that we tend to be very, very detailed once we get into aesthetics. So I grab my cannula. I want you to see the packaging. I think all of this is very important because some of you is your first time experiencing threads. So usually mine come in a package like this. Leon Crate does a great job with packaging. Everything is very detailed and neat. In addition to that, They just have such a huge assortment. You can't go wrong. Like you can't mess up. So it's just like anything else. Like when you don't buy from the best, you just don't have enough in your armamentarium to really give someone a great result. My staff can tell you, and you can follow me and see for yourself that we use everything in the office, and I use multiple styles for every procedure. I don't just stick with one size for a procedure, but this is what a lip thread looks like. But I only work with companies that offer it. And so we have, in terms of our lip threads, this is what they look like up close. You can see it in my hand. Here you go. That's probably not helping it. There you go. So that's the lip thread. And you can explain to the patient that it's on a little needle. I typically don't explain what a cannula is. And you can show them how thin that thread is. They can see the threading on the needle. See it? And that way they can see the length. It's not as intimidating as the lifting threads. And you can, sort of, I guess, relax their anxiety before the procedure if they were expecting something else. But I'm going to place 2 of these today, 1 on each side, because she recently had a filler. So all I want to do is raise up the border of her lip. That's it. Just enhance her role that exists. Just to give you a little bit more insight, I guess some of you would want to also address those very flat lips. And you're going to see a lot of those. Those are, if you start doing lip threads in your practice, you're going to get inundated with cases. Everyone in town that's missing an upper lip is coming to your office. So just beware, get ready. So once upon a time, her lip was tucked and you could barely see it. And now she has a little bit of a lift. We're going to enhance it even more, but we wanted it to become more natural. She may also have, like I said, she has the sloping and the oral commissure. If the inner body of the lip, which now is still very full with filler, that's also a great time to add threads. I like treating with filler and threads if I'm going to use both in the same visit. And I apply my filler first and then my threads. The reason why is because you have lidocaine in your filler, so it automatically begins to anesthetize the patient, the area, and guess what? When you place the threads, it's a smooth process. So, and they really appreciate that. So always kind of think ahead and plan along with the patient. And let's just see if there's anything anatomically that we could also address. The bottom I love, so I don't want to treat it and alter it and make her upper and lower too uneven. That's also very important. Just attempt to not address one arch over the other. Typically lowers are fuller, and that you want to maintain that to some extent. Over time, usually they begin to even out a little bit. The middle third, we want to just make sure her cupid's bow, those peaks, right? That we raise that without altering the philtrum too much, because that slope in here is really important. It looks attractive. So you want to make sure you're maintaining natural anatomy when you're placing your threads. And if you pay attention to all of that, everything that I mentioned, you're going to do an amazing job. Okay, with that being said, I will show you where I'd like to place it, and then we'll start the placement. Just adjusting my stopper. So sometimes you'll take this out and your stopper will be at different levels. I like mine as close to the end of the thread as possible because I use it for measurement purposes, like I can gauge where it's going to stop. So pay attention to that, because when you receive and try your first package, that's what you're going to have to use as your marker. Also, make sure that you take it along the border that you want to use as the actual site and adjust it a few times, and just make sure that where you're placing it, you're going to be happy with that direction. if I was placing hers today in the inner body of the lip, I would place it exactly in that direction. So my entry point would be where that marker is on the bottom, that stopper, and I would enter there, and it would end centrally, almost right. Let's see, open just a little. Okay, and close. Good. So almost right midway between her central incisors on both sides, but we're not placing it there today. We can do that in a future visit. So I'm going to now ask her to relax and sit all the way back. Good. So make sure your patient's head is comfortable. And that's important because movement will actually cause this to move during the placement. And that movement could lead to bruising and bleeding. So in order to just avoid that, the bruising and the bleeding, we would want to make sure that your patient is propped all the way back. I'm going to place my first thread. Very good. I'm going a little higher than the peak of her cupid's bow. That's really important because I'm trying to, like I said, create a lip flip for her. She's a lip filler girl, so I have to impress her a little bit. Deep breath. So I'm in, I've entered. I'm going to just slightly push it, and I'm taking my time with you guys. I really want you to understand this. I can feel, I use my touch, I can feel my thread. You should feel it all the way in. If you're too superficial, you're going to feel it. Close your lips. Good. Good. So once again, I want to feel it. Guess what? You can see it as you're going in. I am ending right there. That's where our lip thread is. Now, I'm taking my time. I'm in filler. It's okay. I'm going to take my time. Good. I'm going to show you as if it's my first time doing this procedure. This is how you should do it your first time. You take your time, and that's where it ends. I'm not quite at the peak. I'm going to approach that peak, but I'm going to pass that peak and then take it up about a millimeter above, a millimeter and a half above that peak. I'm giving her a flip today. Ready? Breathe. You're going to take a deep breath from me. Very nice, very nice. Breathe it out, breathe it out. And she can feel a push, and that's because I'm going through filler. Isn't that cool? It's pretty cool. Okay. Thank you. And now I'm going to just make sure I can see. I'm going to show you where that ends. Can you see it? That's where her thread ends. I can feel the end. That's excellent. Take a deep breath. Good. I'm just going to push, make sure we're at that peak. And it's there. It's right there at the peak. So now I can show you exactly where it ends, and I'm going to leave it there. We're going to do the same exact thing on the other side. Remember, I told you I'm going to take this stopper and I'm going to move it down just a hair to the end of the thread so I can see where my end point is. So I can use it as a marker. I'm going to do the same thing on this side. I'm going to do use the same exact technique. Now, what I like to do is I can see that peak on that side. Look at your patient from multiple directions. And you guys get the added benefit of seeing her centrally and up close. I want to make sure that this height matches the other height. So that's really key. Open, good. Very nice. And I'm going to push her chair back just a little bit for my, yeah. Good, good. I think that'll help your view. And I'm gonna have her take a deep breath in. Good, and I'm gonna check that one more time, only because I wanna go, remember, like about a millimeter above the border. Okay, you can see she has a very defined line, so the differentiation is clear. She's gonna take a deep breath from me, breathe it out, very nice, good. Hold still, good, and breathe, good. I wanna feel it, and I can. I'm just gonna push a little, breathe. Good. Breathe it out. Deep breath. Breathe, breathe. And close. Good. And we're just about there. Take a deep breath, one more, and breathe. You could do it. We're there. Okay, I'm going to now do an observation. This gives me an opportunity to even them out if I need to. I need to do absolutely nothing. She has a clear cut vermilion border. The entire thread is in the lip. Her width of her upper lip, it looks as if we added more filler because more width is showing. If you're viewing it close enough, and I'll sit her up so you can see it. So we're gonna remove them, and that's also a part of the procedure. Hold still. Good. So that width matches the width of her lower lip. Bring your chin down just a little bit in the camera. Right about there. Perfect. Let's stay with them. And you can visually see more of her upper lip now. It's an immediate process, and your patients always say wow after you remove them. So I am going to keep some gauze nearby because if they are a bleeder, it will happen immediately after removing them. So you're gonna take a deep breath for me, very nice. Just twist that thread just ever so slightly and pull out, and that's it. And we're gonna go ahead and place another one. Yep. And twist, and a quick pull. There you go. And I can see a little end on that thread, and I'm glad that I can because I'm going to trim that end. And so I always just make sure that I do that quickly, but I want them to use as much thread as possible. So I tend to move it a little bit, and the patient is now very comfortable at this stage. So after you remove it, if you shift slightly that thread in both directions, you'll see that in one of the directions, you'll see a little bit more of the thread present. And that's really important because in this direction, a little bit of that thread could accidentally become visible. Hold still, thank you. And if that becomes visible to her, she may want to play with it. She might become a little concerned about it and quickly call you and ask you to remove it for her. So just, make sure that you completely remove the thread and bury it. That's really important. And I'm going to lay her down because my reach is off on the side. So I'm just going to tilt her down lightly. And you get to see all of the phases of the procedure. And this is an important one, believe it or not. I remember when I learned how to do threads, no one taught me this part. And I didn't know what to do. The first time I had like a lot of thread hanging out of out after like a facelift, and I didn't really know what to do with it. And I taught myself how to bury it. So now you get to see my technique, which is pretty cool. You don't have to bandage it. What I like to do is just apply a little bit of arnica after. I'm pretty sure a lot of you suture. I suture a whole lot. I mean, I've grafted and done tissue flaps. And so when you do procedures like that and you do this isn't like nothing. Placing threads is nothing once you do all of those procedures. So I'm going to, this is a, hang on just a moment. Have another little piece to remove. I don't think I have the sharpest scissor. Hang on, so I may have to just grab another one. I'm just being particular and getting as close to the tissue as possible so I can show you her close up after. So bear with me. And if there are any questions, we could begin.
Well, I think one of the questions that a lot of people are asking right now, Dr. Bell,
Yes.
not just your choice of threads today, because we used some of the sharp mono threads today,
Yes.
but the blunt tip eye threads and lip threads as well.
Okay.
Although the name is eye thread or lip thread in many cases, threads can be used throughout the body for multiple treatments. So the eye threads, for example, can be used quite often to treat the lip area. With it being a blunt tip, it can cause less trauma, less pain, and less swelling for patients. And some doctors choose to go that way as well. It's all about personal preference.
I agree.
Well, that looks great.
But when you use a blunt tip thread, I just want you to be aware of the fact that it usually helps to create a little bit of an entry point.
Mhm.
So you end up needing like a 25 gauge or something to help you to create that entry point so you're not struggling to get it in there. So you
Sure.
can see that there was already some retention there. And depending on the site, it can, be even more difficult to manage the case. So you can, of course, place the blunt tip in different areas, but they're very flexible when they're thin. And, so you'd better really work on your technique before you try to alternate with them. I find that a sharp cannula, master that and become confident with it. You could see that, and that's okay, that she was a little uncomfortable, but I already know her. She is an anxious person. My average patient is so excited and has had so many procedures done, and they're actually very calm and very they have typically they've prepared themselves for the procedure. So the average person tends to have, I would say, a lower pain threshold. But because I'm familiar with her and I know her, I took my time, and that helps. Don't be aggressive with someone that is going to give you a little pushback. You always want to make them feel very comfortable. So what I did was I left a little of the end out so you can watch me bury it. So can we just come in a little closer? So I think this is fairly important and very cool. Okay. And so when you see the angle, I'm going to actually just shift her face just a little bit before I start. There we go. All right. So there's a little end that we can see visibly. So remember, I was taking it and shifting it just slightly back and forth, and I can push this in and I can bury it, right? The more length I give her, the better. I want to bury as much as I can in the lip. And it's in filler, so I'm going to get a little resistance. But burying it is important because, like I said, you get more use of the thread at the site, and you also get to close the site, so it heals a little nicer. That's what happens, and the patient appreciates that. All right, hang on a second. I'm going to have to trim just a little bit more. That didn't work out quite the way I wanted it to, so I'm going to trim it a little bit.
And while you're trimming,
just a little bit.
Do you want to share with us?
And now let me check the other side. Yes,
we're good there.
Okay, good.
Do you want to share with us when you choose to use PDO versus PCL versus PLLA?
Yes. I do reserve my for my cases that need a large amount of threads. I tend to use a mixture, like a variation, and there's a reason why. Usually I use the nasolabial lines like as a marker, and I'm going to use the lifting threads as my example, because typically lifting threads call for more threads. A lifting procedure calls for more threads. So I do like PDO when I have a younger patient, or when I want, because they were created first. And then we know the other threads are more advanced. And they also, sometimes I'll have a patient that also has a very fair complexion, but they're a candidate for like 5 threads on each side. And they become slightly visible because they have a darker color to them. So I know that they'll become more visible to the patient, and when they're going through the healing process, they'll say, "Oh, I know that my my thread is still there, and you don't want it to be as apparent. So the great thing about our PCLs is that they are clear and extremely aggressive. So the barb style is it's a little different. How would you describe the shape? Because they visibly look different.
So the shape is, it's kind of a little bit steeper of a degree when we are in the cog processing manufacturing arena of things.
That's
not
the
to be too
important
technical.
part. That's the
So
important part.
it provides more room between the thread and the cog itself for lifting. So a lot of times people will comment on the PCL threads as being so much greater with its lifting abilities. And it's not just that, but it
Awesome.
lasts.
They're awesome.
They're amazing. They last approximately 2 to 4 years. And we have those PCLs in mono, screws, and cog threads. We carry our PLLA threads in mono and in screw form simply because they're this crystalline variation of Sculptra. So it gives you a great opportunity to really volumize using threads for a longer duration and still have a cost-effective outcome. We've got over 60 different types of threads at Liaison Cray for you to put in your toolbox to pull from, so you can really customize your treatment plan with your patient, not just based on their end results, but on their budget as well.
So you know what I do that's really, really, really cool? When I'm doing under eye, so another popular area, everyone during the pandemic looks tired. So when I'm placing threads under eye, I can place a load of PCLs. Why? Because of the advantage of them being clear. And then I can, on the lateral border and almost on the upper, I would say yes, on the upper border of the zygoma, place a few of the PDOs, and that the two, because you have more tissue, more width, there's like more fatty deposits there, so they're not as apparent in that area. If you place them under eye, the patient can see them. And they'll say, oh, I love the tightness, like they can immediately begin to see the effects of them, but they can see the color and they're so disappointed, especially, like I said, if they're very vascular there, the tissue is very thin. So it doesn't matter what complexion they are, under eye, they become more visible. So you want to learn like at what site and based on the patient, their needs, their age, which ones are more appropriate. But you do have the added advantage here to add the like your PCLs and PLLAs and the ones that are going to give you that longevity, which they love to hear. Because years ago, they would time out after 1 to 2. Here you go. Yeah, there you go. So after 1 year, I would say exactly around that 1.5 year mark, my patients would always come in, and I'm gonna bring your chair up. My patients would always come in and request another set of threads. Oh, you get to see your lips.
I know.
Are you happy?
I love them.
Very good. You, can I make a suggestion? I think you should go out and celebrate your lips. They look very nice.
They do.
Okay, so I always like to apply a little bit of arnica after. So we're gonna do that quickly. And
That wasn't that bad.
no, it wasn't? Good. Well, guess what? I passed you the tissue, but you teared much less than a filler patient. Yes.
Aren't you done with this and filler?
Every patient does.
Really?
Yes, it's a much easier procedure. Okay, and on that note, I'm going to let you go so I can start answering some questions.
One more push-up.
Very nice. That's how much they enjoy their lips. Thank you.
So we're going to transition now to some questions from the audience. And if you want to just pop in on the chat line, we'll do the best to answer as many as we can. So I'm going to navigate that and read some of those questions out loud. All right. Dr. Bell, can you tell us what are some of your anatomy markers within the lip area that you as a doctor, and more specifically the lip doctor, pay the most attention to that might not be so commonplace for other injectors?
Okay. I am big on, I guess, gauging what my patient wants. Like I said, really become a listener and discuss with them what they like. Believe it or not, remember you said those McDonald arches? There are a lot of patients that don't like that look and they'll say that they want a more rounded look. So just become a listener and make sure that you don't exaggerate something that they don't care for. And what looks good on one person may not look great on another. Also make recommendations and feel comfortable doing that. But I think what's key is that you can gain a lift if you familiarize yourself with the philtrum and leave it alone. You want it to, like I said, leave that slope in there and make sure that you're always raising that Cupid's bow. That's when you make the most dramatic difference. So if by chance I didn't use that measuring technique and I placed that thread too low and it didn't end exactly where I needed it to, my patient would probably be a little disappointed. So that's something that I wouldn't want to experience.
All right, let me go to another question here. This is fun. I like this question.
Let's go to the next question.
All right, I'm going to scroll down here. How many threads per size, or per side rather, do you usually do on a patient?
Let me give you some good gauges. So I recommend that you use a minimum of 2. That makes sense, right? On the border. And then you can always add into the body of the lip about 2 per side. So now we're up to 3 per side. That's 6 just on the upper arch. I think that's about average. What I do in most of my cases is about 6 per arch. So up to 3 on the right, 3 on the left, and something similar on the lower. But remember, we don't want to alter the width too much. So sometimes I will even add an additional one centrally on the lower just to advance it a little bit more and maintain that width so the upper doesn't look like it's larger than the lower.
And just to be clear here too, we have several different threads that can be used anywhere in the body. The lip specific threads are 26 gauge, 50 millimeters long. They come in smooth or twists. The eye threads are 29 by 30 millimeters long, I believe.
Yep.
And those can be used under the eyes, around the eyes, on the lips, just about anywhere.
Wonderful. You have to order some and try them.
I told someone yesterday the eye threads rather are the threads that keep on giving, because once you get them, you'll wake up about 6 weeks later and it's almost like someone came in and painted.
Incredible.
Yeah.
What you
amazing.
can achieve with filler, you can with threads. And remember that. That should be the motto of the brand.
And as a rule of thumb, and a general rule of thumb, I like that, by the way. As a general rule of thumb, do you place threads first, then filler, then any other type of resurfacing treatment? Would that be a recommended course of treatment for a patient who wanted to address?
Like any general area.
Sure.
For the most part, I like adding the filler first. Why? Because of the lidocaine. And it's a less intimidating process for them if they have never experienced threads. So I usually get that out of the way. And guess what they always say to me? Threads weren't as bad as the filler. I love hearing that because I want them to come back and do the second session, because usually I have to reapply or I have to even out something. And then they're prepared and they're ready and they feel much more confident on that second visit.
Wonderful. And if somebody wanted to learn more from you, how would they go about getting in contact with you?
Well, follow us, of course. So you're going to follow Liz on Cray's site, and we have a lot to offer. As they advance, like I said, there are threads, and there are techniques that go along with these threads. And I have used them now for quite a while. And it's been interesting. So my techniques are advancing within my own practice, and I'm changing, and I'm showing Stacy on a daily basis. Oh, look at what I achieved with these threads. I mean, I literally do a facelift, about 2 facelifts per day when I'm in the practice. So that takes up the bulk of my morning schedule. And then we do the lighter thread cases at the end of the day. So I always do my facelifts early on in the day because they're more time consuming, and I like to just take my time with the assessment and use a large amount if I can, and make sure I have adequate time for that. What I like are all the variations that I described to you, the PDOs, and then you really get to, well, after you place them. So if you are monitoring me adjusting the height on both sides, I do something similar with the facelift. And once they're all placed, you can actually see what type of end result you're going to have before you remove them. So you have a little bit of an adjustment period, which is really important with the
Good
threads.
point. So I have two final questions, and these are my own personal questions.
Okay.
Hopefully they'll apply to individuals out there. For a brand new injector who's just starting out with threads, what would be kind of a golden piece of advice you would offer them?
A brand new injector, I would tell you to get as much training as possible. You want to be prepared for things not to go well, and that builds your confidence. For instance, it was really important to me on camera that I left a little bit of that thread out and on intentionally, so you can see me through the struggle. My instructors always did that for me, and I appreciated that. And they would allow me to, it's also good to, be present and do some lives when you have an opportunity to. That tactile sense helps 100%. So there is a depth that you should go to. And when you're too superficial, there's more dimpling, more bruising, more side effects. And guess what? You can't, you're not privy to really experiencing that and seeing it. But feeling those depths, like if you were placing them and I were your instructor, I could help to instruct you to go a little deeper into the epidermis, and that makes a big difference in your end result. Also, if your patient sees signs of the thread, they tend to not like that. And you don't want them to see it, because then they want to play with it, and they will. And it's the summertime, and I don't think that people in the industry talk about this enough. It's hot right now. We have, we're in air conditioning. It's hot everywhere, I'm sure. In the heat, the injection site, your vectors tend to heal slower. You're sweating, and we're wearing masks, and they're not healing as well. And people aren't talking about it. I prepare my patients for it before they leave the office. This way, there are no surprises when you're not getting 100 phone calls after. Always apply arnica, keep the area clean. They're your lips. You're putting food and beverages in your mouth, often. And it can cause infection, and they can also cause that site to expand to the point where they begin to lose the thread. And you run into a lot of complications. So just make sure these are things that you want to experience, and you want to attend a course that makes you feel comfort in applying it. I do feel that although watching the webinars are great, that you practice often, so you can do different levels of cases. And the most important part is, can you, what do you have patient selection parameters? That's really key. You can't treat everybody, and you can't do everything on everybody. So yes, I have, sometimes I can't do a procedure and I have to dismiss a patient, and you have to understand what you're capable of achieving with each style of thread.
Excellent. So I think this often gets overlooked, but for seasoned injectors or plastic surgeons in your case as well, what advice would you give somebody who's skilled and advanced with threads, who still wants to up their game a little bit?
I think that the best thing that you can do to set you apart from others in our industry is to use multiple techniques in one visit. So what you've done is you've eliminated a lot of time for them. I think about my facelift cases. My patients that have an actual surgical facelift, they still come to me after for fillers. So using multiple treatments is still very important. You would be lying to yourself if you said, I had a facelift and I don't need fillers. Usually what happens is they have the surgical procedure done, the surgeon removes all their fillers, and they're like, after the healing process, they can't believe what they look like, and they run to their injector and, and get the fillers replaced. So what I've learned, and this is New York, so we see this all the time. But what I've learned is that if you can add all of those procedures in one, we package them commonly. So I like placing my Botox and my fillers or my plasma during the same visit in conjunction with my threads. Then they really feel and see the difference. That's how you see that's when you see the biggest difference.
Absolutely.
They want that before and after effect. That part isn't as important to me. I appreciate it, but safety is more important to me. For them, people want, they want to look like J-Lo. They want to look perfect. So that's what they want.
For beginners, practice, lots of education and hands-on training. For advanced injectors, combination therapy,
Yes.
That's the wave of the future.
Absolutely.
Excellent. Thank you, Dr. Bell.
That was a
really
pleasure. I had so much
appreciate
fun.
this.
Thank you
It
for coming
was
to my
fun.
office tonight.
Thank you,
everyone.
We will see you all very soon. Appreciate your time tonight.